Good morning, everyone, and welcome back to another session. I am Dr. Supriya Sharma, and today we have with us Dr. Shehrawat, Senior Consultant Radiation Oncology at American Oncology Institute, Gurugram. Dr. Shehrawat holds a postgraduate degree from SMS Medical College, Jaipur, and has been awarded UICC Fellowship from Long Beach Memorial College, California. Today, Dr. Shehrawat will be discussing head and neck cancers with us, and let's begin the session. So, Dr. Shehrawat, welcome. Let's start us with a brief introduction that what exactly do we mean by head and neck cancers?
Head and neck cancers, as we call them, muh, naak, kaan, gale ke cancers. They involve cancers involving the lip, the tongue, the cheeks, the tonsil, palate, आवाज की डिब्बी, as we call it, the vocal cords, maxilla, parotid glands and salivary glands, nasopharynx, etc. These are all head and neck cancers.
Okay, sir. And how common are these cancers?
These cancers are very common, especially in Asia. They constitute about 57% of all the cancers in Asians. And of these 57%, 30% are involving in 30% are in India. So that is the quantum of disease over here.
So, sir, with the cancer being so common, are there any ways that a person can know it at an early stage, but that they're having cancer, or there are early signs and symptoms that a person should?
There are many signs and symptoms which, if a layman pays attention to, these cancers can be diagnosed at a very early stage. Say, for example, if a person feels any ulcer, non-healing ulcer over the lips, over the tongue, over the cheeks, or a person feels any swelling in the neck or swelling in any of the oral cavity organs like tongue, lip, buccal mucosa, the patient should consult the doctor. If a patient is having constant cough, if he is spitting blood out of mouth, or there is blood oozing out of the nostrils or ear, or if the patient is having heaviness in the voice, these are all signs and symptoms which should alarm an individual, and he should consult a doctor.
Okay, sir. So, can you please list out a few warning signs that a person should specifically look out to be able to catch head and neck cancers? A few warning signs, if you can list out, sir.
So, all these things that I have mentioned are the warning signs. Any swelling in this area, any non-healing ulcer, heaviness of voice, coughing out blood, pain in the neck, pain radiating to the ear, etc.
And sir, are there any common causes of head and neck cancers that lead to these diseases or these cancers?
The most common cause of oral cavity cancers or head and neck cancers is tobacco consumption. Tobacco consumption can be in any form, like tobacco in form of bidi, cigarette, khani, gutka, hookah, and especially when they are combined with alcohol. So these are the factors which are highly implicated in the causation of head and neck cancers.
So are there any other factors other than these habits that lead?
Yes, there are some lifestyle habits. Say, for example, nowadays tonsillar cancer is highly being implicated because of human papilloma virus. We call them HPV positive cancers. Especially they happen because of unprotected oral sex. So that's why it is also called sexually transmitted disease. Another virus which is implicated in head and neck cancers is Epstein-Barr virus, which leads to cancers of nasopharynx.
Okay, so and are there any common tests that a person can reach out to or can get them done themselves for early detection?
So as such, there is no test which a patient or any individual should get done on oneself. If any of these signs and symptoms occur, they should consult a doctor, and the doctor will advise a battery of investigations, like he may advise FNAC, he may advise biopsy.
So FNAC and biopsy, what exactly, like for the layman, what is the difference between FNAC and biopsy?
FNAC means fine needle aspiration cytology. In this, a very fine needle is poked into the tumor, just poked it and taken out, and the cells come out which are studied in microscope. They will tell us whether it is a cancerous tumor or not. Whereas a biopsy involves taking out a larger chunk of tissue. So most of the times biopsy is preferable, because in FNAC we only come to know whether it is a malignancy or not, cancer or not. But in biopsy, we will know the exact type of cancer.
So talking about biopsy, there's a myth amongst the general public that
Yes.
biopsy करवाने से cancer फैल जाता है. How true is that, sir?
ये बहुत ही बड़ी गलत धारणा है लोगों में कि बायोप्सी करने से कैंसर फैलता है. ऐसा कुछ भी नहीं है. इनफैक्ट बिना बायोप्सी के हम डायग्नोसिस भी नहीं बना सकते हैं. कोई भी अल्सर है, कोई गांठ है, कैंसर की भी हो सकती है, ट्यूबरक्लोसिस की भी हो सकती है, और भी कई बीमारियां उनकी हो सकती हैं. तो अनलेस एंड अनटिल हम बायोप्सी करेंगे हमें पता ही नहीं चलेगा कि किस चीज़ की गांठ है ये. तो बायोप्सी करना बहुत ज़रूरी है, और बायोप्सी करने से कैंसर स्प्रेड हो ये बात बिल्कुल गलत है.
Sir, having gotten FNAC or biopsy done, what doctor are we supposed to go to or reach out to for the early treatment or the right treatment of adenoid cancers?
Yes, so people are often confused where to go. So the most important link is an oncologist, cancer specialist. But if there is not a cancer specialist in vicinity, one can consult an ENT surgeon, a dental surgeon, or its general surgeon. Any of these 4 specialists can be consulted.
So, like other cancers, is head and neck cancer also staged among the various stages of cancer, and what stages are those, if you can please?
Yes. All the cancers of the body are generally staged in 4 stages: stage 1, 2, 3 and 4. And 4th stage is again of 2 types. One is stage 4 because of extent of local invasion. Another is because of spread to the distant organs like lungs or liver or bones or brain, whatever. So there are 4 stages: stage 1, 2, 3 and 4.
So the outcome of the treatment or the treatment itself, does it different among the various stages of cancer?
Yes. The outcome as well as treatment, both are different for different stages. Say for example, stage 1 head and neck cancers have cure rate and success rate of about 90%. Whereas stage 2 may have success rate of about 70 plus minus 10%. Stage 3 cancers may have success rate of about 40 plus minus 10%. Whereas stage 4 cancers, if they are metastatic to other parts of the body, then the chances of cure are very less. However, if it is locally confined, then again the chances of cure are to the tune of 20% plus minus. And as far as treatment is concerned, so in stage 1 head and neck cancers, they can be treated either with surgery alone or with radiotherapy alone. However, if the disease is in stage 3 or stage 4, then patient may require to undergo concomitant chemoradiotherapy, which means radiotherapy and chemotherapy both simultaneously, or patient may need to undergo surgery first, that is operation first, followed by radiotherapy. So depending upon stage, either radiation alone or surgery alone, or a combination of surgery, chemotherapy, radiotherapy, all those things they will be decided by the treating physician. And there are definite international guidelines for these.
Okay, sir. And is there a specific or a most common route that these cancers spread through, or is there a record that you've seen in your experience?
Yes. So mostly the head and neck cancers will spread to the neck in form of neck nodes, what we call them lymphadenopathy. And thereafter they spread to the lungs and rarely to the liver, bones or brain. But the most common sites of spread are neck and lungs.
Also, sir, are there any population, a set of population that are at higher risk of getting such cancers, or is there any prevalence seen, higher prevalence among men or women, age factors?
Yes. So it has been seen that men are usually affected 2 to 3 times more than women, and generally these cancers occur at the age of around 50 plus.
So one question that is coming to my mind, again, among the general population, there is, I've heard it often that सूरज में जाने से, धूप में जाने से head and neck cancer हो जाता है. How true is that, and कितना exposure is safe, and how would you?
So you might have seen, nowadays we are all watching a lot of cricket, and you must have seen Australian cricketers when they are playing over there, they have white cream pasted on their cheek and lips. What is that? That is a cream with high sun protecting factor, high SPF creams. Why they are applied? Because Australia is a country which is very close to the equator. The sunlight is very high, very strong. Sunlight has got three components: ultraviolet A, ultraviolet B and ultraviolet C. Of these three, ultraviolet B radiation are carcinogenic. So prolonged exposure to ultraviolet B radiation can lead to skin cancers, especially in the lower lip, when they are playing in the sunlight throughout the day for many days. So that is why what you are asking, that sun exposure can lead to cancer, partly true.
Okay, sir. Having covered the types of cancer and the causes, can we now talk about the treatment of head and neck cancers? What are the different modalities of treatments that one should?
Yes. So prior to answering this question, I think I need to answer one more question you asked me earlier, that for staging cancer, we need to do certain tests. Apart from FNAC and biopsy, we also need to do some imaging tests like CT scan or MRI scan, or nowadays very commonly being done is PET CT scan. So by doing these tests, we come to know the local extent of the disease, whether it is still confined to the primary organ or has it spread to the other parts of the body. Depending upon the stage of the disease, the treatment will be decided.
Okay, sir.
What did you ask me just now?
About the treatment of such cancer.
Treatment, yes. So as I told you earlier, there are three treatment modalities for cancer. One is surgery, what we normally call operation. Another is radiotherapy. In Hindi we call it Vikiran Pranali. And in layman language, आम भाषा में बोलते हैं सेक, सिकाई, सिकताव, सिकैया, बिजली, लाइट, करंट, हीट. अलग अलग गांव के लोग अलग अलग भाषा में बोलते हैं. And the third is chemotherapy. So these are the three main modalities of treatment, and depending upon stage and site, the treating doctor will decide what treatment has to be instituted.
So sir, are there any specific complications associated with specific treatment?
Yes. So let me first tell you, radiotherapy, I am a radiation oncologist, and radiotherapy is a treatment which is done over a period of about 35 fractions. Patient is treated with radiotherapy almost 8 to 10 minutes daily, 5 days a week. And every day patient comes at a specified time, gets treated and goes back. The side effects of radiotherapy are temporary. That means they will start at around 10 days to 12 days. They will gradually increase over a period of next 20-30 days. And during last 10 to 15 fractions, they will be slightly more. After completion of treatment, within 15 days to 30 days, the side effects will start decreasing. What are these? There may be slight discoloration of the skin of part of face and neck. Patient may lose hair of the beard for some time. Patient may have loss of taste sensation. Patient may develop blisters inside the mouth, because of which patient may experience difficulty in swallowing, and there may be slightly heaviness of voice. But as I told you earlier, these are all temporary and they will diminish and disappear after 15 days to 1 month of completion of treatment. Similarly, if the patient has undergone surgery, say for example, if the patient has undergone removal of the tongue, partial or total, then patient may have problems relating to removal of the organ. Tongue is an organ which is very important in speaking, in swallowing, in taste. So if the tongue is gone, then one may have these side effects of inability to speak, or there may be difficulty or loss of clarity of speech. Patient may experience difficulty in swallowing, and so on and so forth. Similarly, depending upon the organ that has been removed, patient will have side effects. And chemotherapy as such is not a definitive treatment for head and neck cancers. It is only given either to enhance the effect of radiation or in a setting where cancer is advanced to stage 4.
And sir, I'm sure that these side effects can be managed along the treatment. I'm sure there are treatment available for the side effects as well.
Yes. So whenever a patient is undergoing radiotherapy, we keep reviewing the patient either once a week or SOS, as and when patient feels the need. And depending upon his problems, we do give him treatment. So all these side effects are manageable.
And so one question that comes along with almost all the type of cancers, that does cancer come back once treated? How common, or how does cancer come back ever?
Yes. So there is a term called follow-up. Follow-up means once a patient has completed his treatment, then we keep the patient on clinical checkup once every 3 months for first 2 years. Why do we do so? Because there is a high risk of recurrence of the disease. The cancer may come back. That is why we call the patient once every 3 months to do the clinical checkup, and if required, some kind of imaging in form of CT scan, MRI scan or PET CT scan. Once a patient has completed 2 years, then the chances of disease coming back, they do decrease, and then we keep the patient on follow-up once every 6 months for next 3 years. Once the patient has completed 5 years of follow-up, then it is patient's choice whether he wants to come once a year or as and when required.
Sir, I think we've covered the introduction, the disease, the treatment, and now the follow-up as well. So now for the public, is there any message that you want to give? Are there any precautions that one should take? What is your concluding statement?
My concluding message would be head and neck cancer is preventable. We should abstain from habits, especially tobacco. It should be diagnosed at an early stage, which is easily possible. Every person can notice some ulcer or nodule, which should be checked up by a physician. Treatment is very simple: surgery, radiotherapy, chemotherapy, and cancer is curable.
Thank you so much, sir. That was a wonderful session. We'll see you back soon. Thank you.
Thank you.